In this lecture, we will discuss muscle artifact, including how it comes about, how it appears on the EKG, and how it can be minimized. Muscle artifact is generated by skeletal muscle, just as the name implies, whether it is from muscle tension or from a muscle tremor, as in patients with Parkinson's disease. Okay, you can see that resting tremor. Skin prep does not help as it would with motion artifact, but there are some other techniques that can help with us with this sort of artifact. Let's first look at muscle tension, which is a high frequency artifact between 20 and 150 hertz. Notice that you can still make out regular P waves and QRS complexes despite the abnormal irregular waveform. Okay, so we're looking at this muscle tension. Okay, so that's this one right here, and what we see here is that we can still somewhat make out our P waves here. Okay, here's our QRS complexes. Okay, this is another P wave, another one somewhere here. Okay, so they're still somewhat visible, although you can still see that. Notice that artifact. Okay, you can see that going up and down, and this is that characteristic of a muscle tension sort of high frequency artifact. You want to make sure that all the limb leads are supported and that the patient is lying flat. You can also ask the patient to relax to help relieve the muscle tension, and if pain is likely the cause of it, you may consider giving pain medications. You can also try lowering the upper cutoff to the frequency filter from 150 hertz to 40 hertz to reduce the muscle artifact. So again, you can see that here. Here's our 0.05, okay, 0.05 to 150. 150 is our upper threshold of the frequency filter. If we can then lower that to 40, you can see that. Notice this artifact here is not as bad as that up here. Okay, so there you can see our P waves starting to be more visible. Okay, so notice that the artifact up here, okay, as you lower that upper frequency filter to 40 hertz, you can see that it's much less there, so you can make it out a lot easier. Okay, so that's one little thing you could try to do to alleviate that. Now, with the muscle tremor, this is a medium or a high frequency artifact between 3 and 150 hertz, okay, or 20 and 150 hertz. Okay, and what you want to see here is if the patient is shivering, you want to cover him or her with a blanket. So to minimize that, you can try moving the limb elsewhere to avoid using that muscle that's causing the artifact, or you can consider mildly abrading the skin or checking for any dry gel if there is a motion artifact that's present along with this. Okay, so this muscle tremor artifact is more of a high frequency one. Okay. We say high or medium, meaning it's from about 3 to 150, okay, mostly a high frequency, as you can see here. And what we see is, notice that it's a lot harder to make things out, okay, compared to that with the muscle tension. So some ways to alleviate, remember, if the patient's cold, make sure to cover them. Okay, so you can see our guy here is cold, so make sure to give him a blanket, cover them. Try if there's a certain muscle that's causing that tremor. Okay, make sure you can maybe move the electrode to another position so it avoids that muscle. We mentioned mildly abrading the skin or checking for any dried skin if there's a motion artifact also present. All right, so let's review what we discussed before we end here. So muscle artifact, like we said, is generated by skeletal muscle. Okay, so make sure you're checking your patients if they have any, resting tremor from Parkinson's disease or any other condition, whether it's pain or whatever the case is. Make sure that you try to alleviate that and are aware of that as you're recording the EKG. So with this muscle tension, this is a high frequency one. We mentioned to minimize it, you want to assure that the limbs are supported, the patient's lying flat, ask the patient to relax. If they're in pain, give them medications to allow them to relax, and you may want to consider lowering that upper cutoff frequency. Okay, and we saw from lowering it from 150 to 40 hertz that we can make out some of the waves a lot easier. And in terms of the muscle tremor, more of a high frequency. Okay, in this case, to minimize it, cover the patient. If they're cold, move the limb electrode off the culprit muscle that's causing the artifact. And you may consider also, if there's motion artifact, to mildly abrade the skin and check for any dried skin that may be present. Well, that's the end of this lecture. We discussed muscle artifact, including how it comes about, how it appears on the EKG, and how it can be minimized. I hope you learned something.